Hi, everyone. Welcome to today's Facebook Live and live Q&A via webinar. I'm Caitlin Engel. I'm a registered dietitian and also NKF's Program Development Director. I'm joined today by Dr. Anil Chandraker. He is the Medical Director of Kidney and Pancreas Transplantation at Brigham and Women's Hospital and an Associate Professor of Medicine at Harvard Medical School. Dr. Chandraker, thank you so much for joining us today and helping us talk a little bit more about COVID-19 and kidney transplant.
Good afternoon. Thank you very much for having me. I'm very happy to be here. I mean, of course, COVID-19 is definitely on everybody's mind. That's all you hear about these days. And, I'm very happy to discuss the impact on people who've had a kidney transplant, who are waiting to have a transplant, and of course, are wonderful living donors.
Thank you for joining us. So you're obviously seeing transplant patients all day long. Can you talk with us or maybe answer some of the frequently asked questions that you're hearing a lot from patients?
Yeah, so thanks, Caitlin. So, we actually get a number of different questions, but I think one of the most important ones, which we get quite a lot, is really about the effect of immunosuppression on kidney transplant recipients, because it's an infection after all, and we always drive home to our patients who are immunosuppressed that they do have an increased risk of infection, and people hear about this and they know that patients who are immunosuppressed may be at somewhat of a higher risk of developing infections, and particularly is of concern with COVID-19. So one of the things I would say is that you have to be very careful that you should not be changing your immunosuppression by yourself. It might seem like a good idea that maybe I can decrease my immunosuppression, reduce my risk, but that is really not a good idea. I think there are a number of things that people need to bear in mind, including that a lot of people get infection and they don't have symptoms, and by reducing your immunosuppression, you may well be increasing your risk of rejection. Of the patients who do get sick, there may be some benefit in reducing the immunosuppression if they are very sick, but only really under the supervision of a physician or a transplant expert. And usually we're only doing those for patients who are very severely affected within the hospital setting. So I think it's really not the time to be changing immunosuppression. And certainly if you have questions about that, you should ask your transplant center.
Thank you for that. Would you mind getting just a tiny bit closer to your microphone? I'm hearing a few people having trouble hearing you.
Okay.
But otherwise, that was very helpful. So a number of people are maybe preparing for transplant or are on the waiting list, and they're maybe wondering if they should, if transplantation is safe right now or is recommended in light of COVID-19. Can you talk a little bit to that question, recognizing, of course, that it's going to be different, depending on where you are in the country?
Right, and I think that's the most important thing to say, that different parts of the country are affected differently. And with transplantation, it is very much depends on your local environment. Nearly all centers throughout the country have decreased or stopped living donation, because living donation can generally be deferred a few weeks without causing any problem either to the donor or to the recipient. And so that's not really seen as an urgent issue. As far as deceased donation is concerned, well, CMS has defined it as a non-elective procedure, meaning that centers are still allowed to go ahead and do deceased donor transplants. But a lot depends on what's going on in the hospital, in the area, and there are, of course, concerns about the types of immunosuppression that can be used. So certainly for patients who are maybe at higher risk of having rejection and require higher doses of immunosuppression early on, it may also not be the right time to be transplanted. But each transplant center has worked on their own criteria for evaluating whether now is the right time for a particular patient to get transplanted or not. And so I think it's just important to stay in contact with your center. Mm-hmm. The other thing I would say is that, as most people know, Italy was very hard hit early on with this crisis. And they saw a huge drop in the number of transplants that they were doing because they really didn't have the resources to be able to do transplantation, because they were dealing really with the acute issues of the COVID-19 infection. In the last few weeks, they've managed to increase and open up many of their transplant centers. and start to do a lot more deceased donation. And I suspect that will happen in the United States in the coming weeks too, as we get over this acute phase and we go into more of a recovery phase.
That's good to hear. That sort of makes me feel optimistic to hear that it's kind of recovering in other places. One question that we've gotten from a lot of people is risks to living donors. Are they at higher risk for COVID-19, or is there anything specific that they should do?
So not really directly. I mean, living donors are actually chosen to donate because they are healthy, right? So the average living donor is healthier than somebody in the general population. And so because of that, they're not at higher risk of developing COVID-19. Remember, they're not, of course, immunosuppressed or getting specific treatment. So generally, they tend to be very healthy. They should, of course, take exactly the same measures that we're all taking, you know, social distancing and washing your hands, not touching your face. If you're handling something that's been handled by somebody else, to make sure that you clean your hands after that. So really trying to decrease your exposure, but it's really the same sorts of common sense moves that everybody is being asked to do.
That's really helpful information. I know that's going to ease a lot of worry among those living donors. Well, now I think we'll jump right into questions from our audience. We have a huge audience watching today, both on the webinar and on Facebook. And I didn't say this at the beginning, but no matter where you're joining us from, whether it's the webinar or Facebook, please write your questions into the comment box, into the question and answer box. We'll try to get to as many of them as we can today. And those we don't answer, we'll try to reply to you offline to make sure that your questions get answered. So Diana writes a question that I think a lot of transplant recipients have, is around being a transplant recipient. As things start to open up, as these stay-at-home orders start to be lifted and maybe people return to work, what should kidney transplant recipients do? Should they continue to shelter at home, or are they safe to go back to work? What would be your recommendation for those recipients?
So yeah, so that's a very important question. And I think a lot of the concerns and issues that I hear about are really to do with the fact that we don't know everything about this infection. Transplant patients obviously are thought to be at a higher risk of getting infected because they're immunosuppressed, as we already discussed. And that's just one of several conditions. It's well known now that patients who have comorbidities, if they have heart failure or diabetes, may be at higher risk also. So I think this general concern is very important. It's a very important one to address. I think that, in terms of going out, once the ban has been lifted, remember that the whole idea about everybody staying at home doing social distancing is to do exactly what was being discussed, and that is really trying to flatten the curve so that we do not have a huge number of cases all at once. And there's a lot of evidence to show that that is really happening, that we may well be starting to plateau and come out of this. And I think it's very different depending on which part of the country you're living in and what phase we're going through. And I think if it's generally safe to go out in the community, although transplant patients may be at slightly higher risk, they're not going to be at hugely significantly higher risk than general population. I think a lot depends on your other comorbidities. So I don't think there will be a need to quarantine yourself unless you have a very weak immune system. I think you will need to start to get back doing things, and just to take the common sense precautions. If you need to go back to work and you're worried, then I think still being able to social distance, maybe wearing a mask at work, those sorts of common sense approaches. But I think just because you're a transplant patient per se doesn't mean that you need to really isolate yourself once it's been deemed that it's safer to start to go out and do things that we normally do.
So those patients don't necessarily have to feel like they need to stay home until we have a vaccine in 18 months or whenever that is. They can cautiously maybe begin to get back to normal under the guidance of their doctor.
No, that's absolutely right. I mean, there's all sorts of data that's coming up now about the true rate of infectivity that's coming from China and some of these earlier places where they saw the infection and they have had the opportunity to collect information. And, you know, we've also been doing studies here locally within our own hospital, as many centers have done. And what they're finding is that, you know, the rate of infectivity or your chances of getting infected vary very much depending on lots of local factors. So, for example, one interesting finding that I thought was quite interesting was that, you know, the chance of being infected by going to a supermarket or something else and being exposed to somebody is about estimated to be now 0.5%. And that was really prior to a lot of these you know, precautions that will be put into place. So I think we have to understand that once people have deemed that it's safer to go out, that you know, a lot of these risks have been factored into that.
Mm-hmm. That's helpful. Kind of a related question, but we've gotten this from several transplant recipients, is should they be avoiding going to the hospital to get labs done or blood draws or appointments? You know, what is your recommendation there?
So, so we've switched a lot of our visits to virtual visits with our patients. And I think, you know, what I do is I ask my patients to get their labs drawn prior to that visit. Now, if there's a reason that the patient should not be going in, there may be at significantly higher risk, or they're very stable, and delaying getting lab work by a few weeks is not going to make a big difference, then I think it's reasonable to delay. But I think this, again, is something that if your transplant center is asking you, please get your labs drawn, of course, we are all very aware of what the potential risks are of getting labs drawn. So I think you should follow the advice that's given to you by your center, and it will be individualized, you know, for patients. So it's not going to be the same advice for everybody.
That's a good, really helpful reminder. So another, you know, there's a lot of these questions just around what people can do to stay safe and protect themselves if they, you know, maybe are moving across the country or planning airplane travel, going on vacations. Do you want to touch kind of broadly on what recommendations you have for people in those situations?
Right. So, you know, I think the recommendations are still very much about sheltering in place at the moment. And if at all, you know, you don't need to travel, don't travel. All non-essential travel right now, you know, should not really be an option, because we're still in this phase where we're trying to make sure that even though we may be starting to see some of the effects of isolation and containing the infection, it still is very much a risk. So unless you really need to move, I wouldn't do it. If you do need to do that, I think you have to take all the precautions that you can take. You know, wearing a mask is not perfect, but it does help. You know, making sure that you wash your hands, making sure that as much as possible, you know, you do not handle things that other people are handling. So all of the same sorts of things that we're talking about in terms of sheltering in place. But I would strongly advise people not to travel unless it's absolutely necessary right now.
That's really good advice. How about, you know, we're hearing a lot about shortages of personal protective equipment, masks and gloves and whatnot. If people are having to reuse their masks or other protective equipment, what are there safer ways to do that? What processes should people follow if they're reusing masks or gloves even?
So it all depends on what you've been doing when you've been having your gloves on, right? So I think or your face protection. Remember, face protection, whether it's a surgical mask or a face covering, gives you some degree of protection, but it's not perfect. I think, you know, if you're going into an area where you suspect that there may be other people who are infected, whether they are known to be infected or not. So, for example, you know, if you're going to work and you're having contact with a lot of people and there's the potential that some of these people may be infected, then, you know, when you get home, you need to shower, you need to wash your clothes, you need to change, you know, anything that you're wearing as a barrier, whether it's gloves or a face mask, if you have that ability to do so. I understand that there are shortages of things, and So it is always better to reuse something than to have nothing at all. But I think, if you're taking a mask and you're taking it home, you really want to put it in a place that you're not touching it. You're not exposing it to other people in the household if you have to do that. But ideally, you would probably try to get a fresh covering or a fresh mask or fresh gloves when you go out again.
So would you want to touch at all around, I'm seeing a number of questions both on the webinar and on Facebook, just around like any data that we have on rates or risk for transplant recipients?
Right. So, I mean, that's an excellent question. And it does vary greatly throughout the country. There is a registry, there's several registries. There's a registry at the University of Washington that they have set up to collect all of the information on transplant recipients who've been infected with COVID-19. And they are starting to present some of that data to the transplant community. So there are continual updates on what is happening. And it very much varies. And it seems to be that in places where there's very heavy rates of infection, like New York, more transplant recipients are getting sick, just like more people are getting sick. In other places where the infection rates are not as high, fewer transplant patients are getting sick. So far, we've been very fortunate that although we've had less than 10 patients who have been infected, they've all done relatively well so far. So it's very variable. And I think, again, it really does depend on the local geography. What is the likelihood of getting infected? And, it's probably also related to how much of the virus you're exposed to. So not just a chance exposure, but repeated exposure, or the amount of virus that you're exposed to.
That makes sense. So I'm guessing you kind of touched on this just now, but do we have survival data rates as far as kidney transplant recipients and how that maybe compares to the general population survival rates from coronavirus?
So again, we don't really have that kind of data. And because the experience is so variable for transplant recipients, depending on the part of the country that they're in, it's very difficult to actually generalize about something like that. I think there will be information coming out with regards to that, but it's probably, and the other thing is that it's changing day to day. So that the numbers of people getting infected, what their course is like, how they're responding to treatment, etc., is being updated on a very regular basis. But I would say that we are pleasantly surprised that the risk to transplant recipients is not as high as we thought it might have been.
That's good news. Another question that we're getting from a number of people, partially because of what's maybe in the media, but is around maybe shortages of medications and people having difficulty getting specific medications, including immunosuppressive drugs. Do you want to talk a little bit about that? Like what is the reality of that situation and what should patients prepare for regarding these potential shortages?
So, I think this is an area that we've also heard concern about. We've had a number of patients call, I think particularly early on, saying that they were having some difficulty getting their medications. Usually it was related to a local supply chain issue. It's not that there was a real shortage of the drug, but there's a shortage or a disruption to the distribution system. So that, in all cases, we've been able to manage to get, the immunosuppressive medications to our patients. And I think that's been true in most places. I think a lot of those issues have been ironed out. The concerns about there being huge supply issues because many of these medications are manufactured in China and India and other countries. We have not reached the worst case scenario with that by any means. So generally speaking, although there may be some local shortages or local effects, overall, the supply chain seems to have been maintained relatively well. And I know that this is obviously one of the things that the NKF has been lobbying for in terms of making sure that elected officials pay a lot of attention to this and also working with contractors to make sure that these drugs are available for transplant recipients.
Yeah, that's really helpful and some good news. Kind of a related question, and maybe this is not an issue based on what you just said as far as things, the supply chain seeming to bounce back a little bit. But if there is a shortage of a brand name medication and someone gets switched to a generic, are there adverse effects, or do they have to worry about having trouble with that, or any risks to their transplanted kidney?
So, generics are approved because they're believed to be safe, and they're believed to be an equivalent medication compared to the brand name drug. And that's why they're approved. Now, with a switch of any medication, there can be small differences in terms of the absorption and therefore the levels of the immunosuppression in the blood. So we have found that we have switched many of our patients onto generics over the last few years, and we haven't really found very major problems. There's occasionally a patient who does seem to very much not, a generic may not agree with them, but I think that's true of generally any medications, and it can be true of switching from one brand to another. I think as long as levels are being tested, particularly for tacrolimus or everolimus or sirolimus, or the drugs that we test the levels for, there's a way to know if the switch has affected the body's ability to absorb that medication in the same way.
That's good to know. So let's switch gears just a little bit. Christopher asked, and I'm not sure how much you can touch on this, but about any like prophylactic treatments for transplant patients to maybe prevent COVID infection, any antivirals or anything. Is this being done regularly? Is this a case-by-case basis? Is there any, is this something that may happen more in the future?
So there isn't really a prophylactic medication for COVID-19. And, I think I understand why the question is being asked. We do use prophylaxis for other viral infections, which are very different than the coronavirus. And there isn't really a prophylaxis that's available. The best prophylactic will be the vaccine when it becomes available. And so when the vaccine becomes available, it will be a sort of a good way to protect yourself from infection. There are a number of things that you see on the internet about medications or herbal supplements. I would urge everybody really not to look at those things. You really need to speak to your transplant center before starting anything that is not prescribed for you. Some people say, well, these are benign things. Some of these are just vitamins or herbal supplements, but they can interact with your immunosuppression, and you have to be very careful. And the other point I would make is that even if you can look something up and say, well, there's no known interaction between your immunosuppression, these are not FDA approved. There's no real way of knowing what's going into a lot of these supplements, and so you're taking a gamble, and because there's no proven benefit, it's not worth it.
Yeah, I think a lot of people don't realize that supplements aren't controlled or tested the same way that medications are, and you really do have to be careful with that. So let's talk about a vaccine for a minute. Do you know, or can you speak to if transplant recipients will be towards like the higher priority of people that will get a vaccine when it's available? Did we lose you? Just give him a minute. Maybe there's some audio issues on his end. Uh-oh. Well, looks like we're having some technical difficulties and we lost our physician expert. I'm just going to give him another minute to see if he can get logged back in. And while we're waiting, I'll maybe just take a minute to talk about some of the things that NKF is doing right now to keep kidney patients, transplant recipients, living donors protected and taken care of during this time. So our government relations team has been very busy advocating with our elected officials on taking care of kidney patients. This week, we're delivering a letter directly to Governor Andrew Cuomo in New York State with suggestions on how to address shortages in dialysis and other critical equipment that has been covered in a number of news stories recently. We know that particularly for those with chronic kidney disease, it's very essential that New York and every state maximize their existing resources, tap into the national stockpile, and support efforts to increase production and distribution wherever possible. We also are sending a letter to the Department of Health and Human Services asking them to prioritize COVID-19 testing for the kidney community, since we know that both kidney patients and providers who are caring for them are at higher risk. And lastly, we've been working with federal contractors on a few other issues of priority for kidney patients. The first is to make sure that transplant patients can access a 90-day supply of their medications so they aren't having to travel back and forth to their pharmacy as often. We know that those as Dr. Chandraker said, those medications are so important for transplant patients to be taking. So we want to make sure that they can get them, but that they can get them without being putting themselves at risk or potentially being exposed. We're also working to address the issues some patients have had with transportation to and from dialysis care and other essential medical appointments. We also know that for some people, telephone appointments may make more sense, and we are pushing Congress and the administration to ensure that telemedicine services are available. So a lot of things that we're doing right now to really advocate for and push for kidney patients to be taken care of during this time. I'm hoping that maybe Dr. Chandraker can join us again, but if not, we'll give him just another minute or two to try to get logged back in. Technology is always a challenge. Make sure that if you haven't, you check out our coronavirus page on kidney.org. It's kidney.org/coronavirus. We have a lot of information up there. We've answered a lot of questions that patients and family members might have around how do they take care of themselves, what should they do. There's lots of great resources there. And I will say that for all of you that have submitted questions that we maybe haven't gotten to yet, we will make sure that we reply to those questions. We can reply to the questions in the comments on Facebook, and we can also connect with those of you who submitted questions via webinar via email, provided that you didn't submit your questions anonymously. So yeah, I'm very sorry that this got cut a little bit short due to technical issues. But I thank you guys all for joining us, and I hope that you'll keep following us on Facebook and joining our virtual events that we're trying to do. Oh, I killed just enough time to get him back on. Excellent.
I'm sorry, but I don't know what happened. Our internet seemed to go down.
Technology is not always our friend. No worries. I just filled everyone in while we were waiting for you on some of the advocacy efforts that NKF has been pushing. So people got some good information while you were gone.
Sorry about that. Okay.
No problem. So the question I just asked you before you got knocked off was around a vaccine, and if kidney transplant patients would be prioritized at all in terms of who gets that vaccine when it first becomes available.
So I think that if when the vaccine becomes available, it's very likely that enough doses of that vaccine will be available for everybody. Mm-hmm. So I think one of the things that's occurred with vaccine research is that it's much easier to develop candidates. Mm-hmm. But the reason it takes so long before a vaccine becomes available is that you have to do the clinical trials to make sure that it works. Mm-hmm. But obviously, it's something that the CDC is very focused on, and they know that once a vaccine is approved, they're going to have to be able to manufacture it in very large numbers of doses. So I don't suspect that would be the case. However, if it were the case, then I think the patients who are most likely to be vulnerable would be the patients who would be most likely to get the vaccine. So I think as immunosuppressed patients are within that, fall within that area, it is likely that they would get vaccinated on a priority basis, but that's just my opinion.
Yeah, a lot more to be learned as that becomes available. So a number of people are submitting some questions about if they might get infected as transplant recipients, if they get COVID-19. Should they expect any different treatment? Are the sort of known treatments, and I realize that we don't know a lot about effective treatments yet, but are there any differences in how you treat a patient with COVID-19 if they are a transplant recipient?
So that's a very good question. And I think that the first thing I would say is that if people get infected, it doesn't mean that they're all going to have a bad outcome, right?
Mm-hmm.
So the majority of people who get infected with COVID-19 actually have very mild symptoms, and that's true of transplant recipients as well. That does not seem to be that different than the general population. In fact, although it's very difficult to generalize, it seems that the patients who are particularly at risk who have transplants are the same as non-transplant patients, people with other comorbidities and who are older. But it's also true that a lot of patients who are older with other are also doing very well. So it's not all doom and gloom. However, it is very serious, and 20% of people may get moderate to severe disease with infection. Now, there are a number of clinical trials that are ongoing, and the treatments that are being used for transplant recipients is the same as it is in non-transplant patients. There are, however, a few caveats. So one is that there is a lot of discussion about when and how much immunosuppression in a severely infected patient should be decreased. And we're coming together in terms of some consensus in that there's a lot of communication between transplant centers, there's a lot of sharing of experience, and so there is more of there's more of a unified way of treating these patients. There are other issues that do occur in that some of these treatments are not suitable for transplant recipients. So hydroxychloroquine, for example, is one that people have heard a lot about. That interacts with lots of different medications, and that may not be a good choice for a transplant recipient based on their immunosuppression or their other medications. And it may be that it's not a particularly useful drug. It's probably not showing as much promise as was initially hoped. The other medications, there's one which cannot be given because you have to have very good kidney function in order to get it. And even transplant patients who have good kidney function, there may be concern about giving a drug because of that. And then lastly, some of these drugs interfere with the immunosuppressive drugs and either decrease or increase the levels. And so that has to be taken into account. In that situation, it doesn't necessarily mean that you cannot receive the drug, but it means that it has to be monitored carefully, and those things have to be factored in.
That's helpful to know. And I love hearing that transplant centers are communicating and sharing with each other. I think everyone's kind of learning as we go through this process. So it's nice to hear from you that everybody's sharing their learnings as they can. Barbara asks about, the kidneys possibly being affected from COVID-19. Are you seeing that transplant patients, or really anybody who's getting COVID-19 and maybe having some acute kidney injury, or if they're a transplant recipient, maybe their kidneys getting affected, are those kidneys recovering when the patient recovers, or are there any long-term effects from that infection on their kidneys?
So that's a very good question. Even for patients without transplants, there's an increased risk of having some form of kidney injury if you get a severe infection. Generally speaking, that seems to be related more to the effects of the infection on the body and the effect that it might have on increasing inflammation, or the effects on blood pressure, which then will affect kidney function. And so in many of those cases, they are recovering. In terms specifically of transplant patients, well, in theory, the same sorts of issues should apply. And certainly we have seen some patients who have kidney function that's affected. Generally speaking, it doesn't seem to be, it is not a concern to the extent that everybody who has this infection is going to have their transplants shut down. It's nothing like that. And we've seen many cases where if the kidney function is affected, it recovers fully. On a related question, and it's one that I think someone else has asked me, is whether there's an increased risk of rejection, and how would that affect a transplanted kidney? Well, so there's potentially increased risk of rejection. I've only heard of one case from talking to my colleagues up and down the country of a patient who's had rejection after COVID-19 infection, and that is partially related to maybe decreasing the immunosuppression. There are some ideas that when you get an infection, it generally increases your risk of rejection, but it's not been something that has been seen, or it's not emerged at the time being as a big issue.
That's got to be reassuring for a lot of people. This is an interesting question from Adam on the webinar, and I've seen a few other people ask this. What about potential living donors? If they get COVID-19, is that going to affect their chances of being able to donate a kidney in the future, like once they're recovered?
That's a great question. And thank you for that question. I would say probably not, right? Because once you've recovered, it's like, recovering from any other infection. You'll develop antibodies. Hopefully those antibodies will be protective, although nobody can say because we've never faced anything like this. But it shouldn't really affect their ability to be able to donate once they've cleared the infection.
Yeah, that's good to know. I've seen this, Nancy's asking this question on the webinar, and I saw a few people ask it on the Facebook Live. How about people who are passing away from COVID-19? Is there any chance their kidneys are able to be donated?
So generally not. So with all deceased donors now are getting tested for COVID-19 infection, which again is very reassuring in terms of the transplant chain. If somebody tests positive, then they would not be used as a donor. And part of the reason for that is that, first of all, we don't really know for sure exactly what's going on, but there is evidence to show that the virus can be detected within the kidney. And so if you have virus being transmitted during donation, there's a big risk to the recipient. So certainly, I think nobody would be prepared to take a patient who has COVID-19. And for that reason, we're doing the testing.
That makes a lot of sense. That's good to hear. A couple back to vaccines, because when we talked about that, it looks like it drew up a few questions. On the webinar, Michelle asks if you know, and you may not know this, but will the vaccine be made with a dead virus so that transplant patients can take it? Or I'm assuming that whatever vaccine we come up with, hopefully will be something that will be approved for transplant patients as well.
So it's not really my area of expertise, but I will say this: it is a coronavirus, like the common cold, and usually those are viruses that are not live vaccines. So I would imagine that it would be very similar.
Yeah, good to know. I realize we're stretching your knowledge here with some of these details about vaccines. So I'm just scanning through our questions here. We've talked about a lot of these. Oh, I know one that I've seen a few times. What about people who are transplant recipients that maybe live with a caregiver who is working outside the home or might begin to go back to work as the country opens up? Can you talk at all about maybe what precautions or what recommendations you would make to that household to try to protect that transplant recipient as much as possible?
Yeah, so that's a very interesting question, because I think just as we've seen on a week-to-week basis, the types of advice that's given has been changing. What's expected of people has been changing. And so currently we would say that if somebody's going out and they are being exposed to COVID-19 positive patients, a frontline worker, then you would want to isolate a transplant patient or anybody else really from a lot of contact, and as much as possible have separation, different living areas within the house, and out of an abundance of caution, really say that treat that person as a potential person who could infect you. And we know that there are a lot of asymptomatic patients who've developed COVID-19. So you have to be very careful. And I think the same will be true when we open up. But again, as the country opens up, what you'll see is the risk of somebody actually randomly getting COVID-19 from being out in the community is going to decrease. So that's going to change. So I think, but until it does, I think people should be very cautious about that. And again, the same sorts of things that we said before. If somebody's coming into contact with a higher risk population, when they get home, they should shower, they should wash very effectively, they should change their clothes, they should wash their clothes, and just be very careful.
Yeah, thank you. That's helpful advice. I know that's got to be a really hard situation for people who live with healthcare workers and are also trying to keep themselves safe. Diana on the webinar here is asking, she says, I'm concerned about African Americans dying disproportionately from COVID-19. She says she's at higher risk. What else can she do to protect herself? Or can you talk at all about that?
Right. So I think this has been one of the concerning things that we've seen, is that the disproportional effect this is having on minorities. Particularly some of the data that shows African Americans and to a lesser degree Hispanics, and people from a poor socioeconomic background. And so it is we don't fully understand that yet. There are certain conditions that disproportionately affect one part of the population more than the other. And the reasons for that can actually be quite complicated. They can be related to the ability to access services. In a situation with an infectious disease, it could be related to the inability to distance yourself. So if you have a smaller house and there are more people living in the house, or the family structure is such that you have 3 generations living there, it can be very difficult to follow some of these guidelines about distancing. And some of it may be that. Some of it may be a genetic predisposition. We know that African Americans have a higher risk of kidney disease, for example. And we know that there is a genetic component to that, which we didn't realize until a number of years ago. And so some of these factors that are causing that are not particularly well understood right now. But I suspect there's going to be a lot of focus on trying to answer that question. And in terms of what you can do, I think the best advice you can give is exactly the same, and that is, as much as possible, really try to follow these precautions in terms of distancing and exposure and self-isolation and washing and all of those things that we've talked about.
Thank you for covering that. A good question from an attendee on the webinar that I think a lot of people are wondering is, what about the safety of takeout food or getting food delivered? What are your recommendations for that?
So, I mean, that's a very good question. I mean, there is the potential to have contact, but the risk of takeout food and the risk of getting contaminated from containers and plastic bags is a lot less than it is from direct contact, because remember, this is a droplet infection that is spread by coming into contact with droplets that are emitted from the respiratory tract of another person. Now, yes, these can rest on different surfaces, and there is some concern that you can possibly transmit it from there. So I think the precautions that people have advised is that, if you're bringing in takeout, get rid of the plastic bags immediately you get into the house, take the food out of the container, throw the containers away as soon as you've done that, and really try to minimize the contact between any object and any surface within your house or your own hands. And once you've got rid of the plastic bags and containers, wash your hands thoroughly. And so I think you have to use those kinds of precautions, but understand that it's not very, that it is it's still relatively safe to eat takeout food if you follow those precautions.
Mm-hmm. Thank you. Well, this has been a really, really informative event, and I really appreciate you coming on and joining us. We had, huge attendance both on the webinar and on Facebook, and I know we did not get a chance to answer all of these questions, but as I said earlier, we will go ahead and reply to you all individually with those responses. So hopefully everyone's questions do get answered. And Dr. Chandraker, thank you so much for joining us. It was just a treat to talk to you today, and we really appreciate you giving up time out of your busy schedule. And everyone else, just make sure that you're following NKF for updates. We're publishing new information daily, and make sure you stay connected with us during this time.
Okay, well, thank you again for having me, and thank you to the NKF for doing an outstanding job and providing all these resources on the internet and to our patients. That's really appreciated by us healthcare professionals, and stay safe, everybody.
Thank you.